Alice in Wonderland. This thing messes with how you see stuff. You don't see things the way they really are. Like something small might look huge, or something big might seem tiny. It's like falling into Alice's weird cartoon world. Most of the time it comes with a headache or a migraine, and it mostly shows up in kids and teens. You might think the room, your hand, or even your whole body looks super big or really small, and that totally messes with your head. Basically, your eyes and brain aren't on the same page, so stuff looks kinda distorted. But don't worry, it's not dangerous, and it usually goes away after a while. Foreign accent. A super rare condition that happens after a hit or some kind of brain injury. The person who gets it suddenly starts speaking with a foreign accent, an accent they've never had before. Like a Spanish person might suddenly start talking with a French or British accent without ever learning that language or accent. This usually happens after a stroke or brain damage, and it comes from changes in how the brain controls speech muscles. It's kinda like the brain is messing up how to talk, and that weird accent shows up. The new accent isn't real, it's just from a nerve issue, but it feels super strange and unexpected for the person and people around them. Hypertrichosis. In this rare condition, the person's body gets covered in an unusual and extreme amount of hair, even in places like the face, forehead, ears, nose, or even eyelids. Some people with this actually end up looking like wolves or mythical creatures. That's why it's called werewolf syndrome. It can be something you're born with, or it can show up later. There's no real cure, just stuff like laser treatments or shaving to reduce the hair, but it always grows back. It's not dangerous, but socially it can be really tough because their appearance draws a lot of attention. Pica disorder. Pica means eating stuff that's not food at all. People with this disorder might have a strong urge to eat dirt, chalk, ice, paper, hair, metal, soap, or even batteries. Not as a joke or curiosity, but a real persistent craving that they can't control. This disorder is more common in kids or people with iron or mineral deficiencies. The brain mistakenly thinks these weird things will fulfill some body need. What's the danger? Well, some of the things they eat are toxic or dangerous and might seriously harm the body, especially the digestive system. Savant. A weird and special disorder where a person might have mental or developmental disabilities, but in one specific area has incredible genius. For example, someone might not be able to form a simple sentence, but can compose a whole symphony, or with one look, paint a landscape from memory, or do complex math calculations in their head. This syndrome is usually seen in people with autism or those who have brain injuries. It's like one part of the brain is damaged, but another part works way stronger than normal. Famous example? Kim Peek, the inspiration for the movie Rain Man. He could read an entire book just by flipping through it once and remember it all. Cotard delusion. In this rare mental disorder, the person believes they are dead, or that their body no longer exists, or that their body parts are rotting, or even that their soul has left their body. Some think they are in hell, some believe that blood doesn't flow in their body, or that their heart has stopped working. This disorder usually appears in people with severe depression, psychosis, or brain injuries, and it's like the brain loses its sense of physical existence and being alive. It's kind of like a nightmare that never ends. The person, while awake, thinks they're really dead. Treatment is hard, but with medication and psychotherapy, in some cases, it can be controlled. Alien hand. In this condition, one of the person's hands acts completely on its own. It does things that the person has no control over. Like, while eating, the alien hand might throw the spoon. Or while getting dressed, it might undo buttons that the other hand is trying to fasten. The person fully knows it's their own hand, but feels like some other being is controlling it. That's why it's called alien hand. This disorder usually happens due to brain damage, especially in the corpus callosum area or after brain surgery. Exploding head. Even though its name sounds scary, no one's head actually explodes. In this disorder, right when someone is about to fall asleep Or just after they've fallen asleep, they hear a really loud sound like an explosion, a gunshot, a scream, or metal crashing right inside their head. But there's no real sound at all. It doesn't come from outside, it's coming from inside the brain. It feels like something just popped inside the brain with a shock, heart pounding, and intense anxiety. But there's no real pain or physical damage. The exact cause isn't clear yet, but scientists think it might happen because parts of the brain don't shut down properly when falling asleep, or maybe due to stress, lack of sleep, or mild neurological issues. Epidermodysplasia verruciformis. In this very rare genetic disorder, the person's skin starts growing outgrowths that look like branches, tree trunks, or roots. These are actually large, rough warts that are hard to control and can cover entire hands or feet, making the limb unusable. What causes it? People with this condition are unusually sensitive to the HPV virus. A virus that's harmless for most people can become a disaster in their bodies. Treatment? There's no permanent cure, no vaccine, and no specific medication. They can only remove the growths temporarily through surgery or laser, but they grow back. The most well-known case? A man from Bangladesh who was called Tree Man and whose photos spread worldwide. Guilford progeria. Progeria is a genetic disease that causes a child to age at an unbelievable speed, so that an 8-year-old child looks like a 70-year-old man. In this disease, a gene mutation causes the production of a faulty protein called progerin and also rapid cell deterioration. The result? Severe skin wrinkles, hair loss, heart disease, bone weakness, short stature, and early death, usually before the age of 15. The minds and intelligence of the children are completely normal. They think and feel just like other kids, but their bodies are aging rapidly. This disease is extremely rare, affecting only 1 in every 20 million births. Trimethylaminiuria. This condition is genetic, and it causes the body to not properly break down a chemical called trimethylamine. When trimethylamine builds up in the body, it produces a really bad smell, like rotting fish, that comes out through sweat and the person's breath. People with this condition often face constant embarrassment and shame because the smell is always there and doesn't go away easily with showering or using perfume. There's no permanent cure, but with a special diet, like avoiding foods high in choline, such as eggs, fish, and legumes, the body odor can be reduced. FOP. In this genetic disease, the body, instead of repairing soft tissues like muscles or tendons, turns them into bone. That means, in a way, the muscles, joints, and even ligaments gradually become stone-like and immobile. This process usually starts from the neck and shoulders and gradually spreads downward. Even a small injury or a regular injection can trigger the body to turn another area into bone. Stranger fact, even surgery to remove the extra bone is useless because the body will grow bone in the same spot again, even worse. Most affected individuals show symptoms from childhood and lose their mobility very early. Eventually, the person might only be able to blank or breathe. Methemoglobinemia. In this condition, blood can't carry oxygen properly because an abnormal type of hemoglobin, called methemoglobin, builds up in the body. The result? Oxygen doesn't reach the tissues, and the skin takes on a bluish, grayish, or purplish tint, like the person just came out of a freezer. Some people have this condition genetically, like the famous Fugate family from Kentucky, USA, who lived for generations with blue skin. Others get it due to environmental reasons, such as overuse of certain medications or chemical exposure. It's usually not life-threatening, but can cause symptoms like shortness of breath, weakness, or chronic paleness. Treatment depends on the severity and may involve medications like methylene blue. Gelestic seizures. In this rare disorder, a person experiences sudden, intense, and uncontrollable episodes of laughter, even when there's nothing funny at all. The laughter may sound strange, dry, mechanical, or even scary because there's no real feeling of joy behind it. These laughing fits are actually a form of neurological seizure, often caused by a tumor or abnormality in a part of the brain called the hypothalamus. Other symptoms? Sudden onset with intense laughter, followed by confusion, numbness, or sleepiness. It often begins in childhood, sometimes with strange sounds, crying, or repetitive movements. Treatment? Anti-seizure medications may help, and if it's caused by a hypothalamic hamartoma, surgery might be necessary. But full control isn't always easy. Bell's palsy. This is a congenital neurological disorder that causes the facial muscles to be paralyzed or very weak. That means the person can't smile, can't frown, or cry. Their face always has a fixed, emotionless expression, like a mask. Why does it happen? Because of underdevelopment or absence of cranial nerves V and VI, which control eye movement and facial muscles. Some people may not even be able to move or close their eyes. What's life like with this syndrome? People with it usually have a completely healthy mind and emotions, but since their face shows no reactions, others might think they are cold or emotionless, which isn't true. With surgery or physical therapy, they may regain some facial movement, but there's no complete cure. Capgras delusion. A person with Capgras delusion believes that someone close to them, like their mother, spouse, friend, or even a pet, is no longer themselves. They think an exact duplicate has replaced that person. For example, a kind mother may suddenly seem like a dangerous imposter pretending to be her. Why does this happen? This disorder usually occurs due to damage in certain areas of the brain. The person recognizes the familiar face, but feels no emotional connection to it. So the brain concludes, this isn't the real person, it's a double. It's most commonly seen in people with schizophrenia or dementia. What's life like with this delusion? Extremely difficult. Because the person may fear, run away from, or even harm their loved ones just because they think those people aren't real. DID. A person has more than one personality inside their mind. Each personality can have a different name, gender, age, voice, and even behavior. One might be kind, another aggressive. One is a child, another an adult. Each may take control of the body at different times. The person usually doesn't remember what happened when another personality was active. The main cause is often severe trauma or emotional damage in childhood. To cope with the pain, the brain creates different personalities. It's not easy to treat, but psychotherapy can help. Munchausen. The person intentionally makes themselves sick or pretends to be ill just to get attention. They might take medicine to feel unwell, mess with their wounds, or fake pain. They're not after money, and they're not typical liars. They just want to be treated like a patient. The reason is usually a deep need for love, sympathy, or attention, often rooted in past trauma. A more dangerous type is called Munchausen by proxy, where someone makes their child or another person sick to be seen as the heroic caregiver. Mirror touch synesthesia. Imagine watching a video where someone gets slapped in the face, and even if no one touches you, you actually feel that slap on your own face. That real, that's strange. People with this condition physically react when they see someone else being touched or hurt. Someone gets hugged, they feel hugged too. Someone falls, their own knee aches. Their brain is different. The boundary between self and others is blurry in their mind. That's why whatever they see, their body mirrors it with full empathy. Sometimes it's a gift, sometimes a curse, because they can't just watch, they have to feel it too. Self-harm. In this disorder, a person starts chewing, picking at, or eating parts of their own body. It usually begins with nails or skin, but some people may go as far as flesh on their hands, lips, tongue, or even their fingers. It's not just a habit or an obsessive behavior. Sometimes it's linked to severe mental conditions like major depression, schizophrenia, trauma, or it may even be part of a condition called pica. Sometimes the person doesn't feel pain or feels calm by doing it, even if it leads to wounds, bleeding, or permanent damage. Synesthesia. In this condition, the brain mixes up the senses. What does that mean? It means, for example, when someone hears a sound, they see a color. When they see a number, they taste a specific flavor. Or the name of a person might have a smell or a texture. Their mind is wired differently. For instance, when someone says 2, they actually see the color green or taste lemon. Interestingly, many of them don't even realize it's unusual because they've experienced the world this way since childhood. It's not painful or dangerous. On the contrary, many artists and musicians, like Pharrell Williams or even Beethoven, had this condition and drew inspiration from these sensory experiences. Depersonalization disorder. In this disorder, the person feels that a part of their body is extra. For example, their hand or foot doesn't feel like it belongs, isn't theirs, or shouldn't exist. Some say, since childhood, I felt this foot doesn't belong to me, or I wished my hand was amputated because it feels like a nuisance. This feeling isn't just a momentary thought, it stays with them for years. Some even risk harm trying to paralyze or amputate it because only then do they feel complete. The exact cause is still unknown, but most likely the brain doesn't properly recognize that body part, or the brain's body map is incomplete. Autobrewery. A rare disorder in which the person's body produces alcohol without actually drinking any. How? Some fungi or yeasts overgrow in the person's gut and convert the sugars from food into alcohol. The result? The person might get drunk or intoxicated or show symptoms of alcohol poisoning. Symptoms include dizziness, blurred vision, fatigue, and even neurological problems. This condition usually appears when the gut's microbial balance is disturbed, for example, after taking antibiotics. Aquagenic urticaria. A rare disease in which, when water touches the skin, the person quickly develops itching and hives. These hives are red and raised and may be accompanied by burning sensations. This is not an allergy to water, but the body shows a hypersensitive reaction to a chemical reaction of water with the skin. Patients usually have to be very careful because even showering and rain can trigger their symptoms.